right, I think we will go ahead and get started. Thank you all again for joining us on your Friday morning. We hope everyone's doing well. And I am Catherine Hines, an Educational Services Assistant Senior at the Kentucky Injury Prevention and Research Center. So welcome. And I'll go over the agenda and then we'll get into our presentation. So we'll get started here. So today, I'm going to start with, sorry, I have a train going by in the background. I'm going to mute myself for just a second. Okay, there we go. Sorry about that. So we'll do some welcome, and then I'm going to give some FindHelpNow background in case there is anyone joining us today who is not quite familiar with what FindHelpNow is and kind of what that program includes. And then I will introduce our guest speaker today, Danita Coulter, and then she will give her presentation. And then at the end, we'll save a few minutes for Q&A for Danita on her presentation, as well as anything else related to FindHelpNow. And then I'm trying something new with the survey this time. So we usually do a post-webinar survey where we ask for your feedback to help inform, let us know how we did today, as well as inform future webinars. And so the way that I set up the meeting, if it goes right, is when you click to leave the meeting, the link for the survey should pop up in your web browser. So we're going to try that new. I'm also going to put it in the chat box just in case, and it'll go out in the follow-up email that will go out following this webinar as well. But just wanted to note that's something new that we're going to try this time. So FindHelpNow was created as a resource to provide near real-time substance use disorder treatment openings in less than a minute to anyone who is searching. Those individuals searching can be individuals looking for treatment for themselves. They can be family members or loved ones. So this is a public-facing resource. And then also healthcare professionals, individuals who are kind of doing referrals to treatment can also use this website resource to try to find availability based on their clients or whoever it is that is searching based upon their specific needs. So there's different filters that you can select based upon payment method, treatment type, additional services, wraparound services, that kind of thing, location. And so this was created by the Kentucky Injury and Prevention and Research Center through CDC funding. And right now it's being funded by the Overdose Data to Action Grant. And this grant allows Kentucky the unique opportunity of sharing this website platform with any OD2A funded jurisdiction that is looking to create or implement a linkage to care resource of this kind. So if you have any questions about it or are interested in implementing it in your jurisdiction or just to learn more about it, feel free to email me or Danita. Our emails will be at the end of the presentations for you. And then we can also provide technical assistance to jurisdictions who are implementing their own linkage to care resource. So if FindHelpNow does not meet your needs, but you are working on something else related to linkage to care, we can also provide technical assistance on a variety of topics related to both creating, developing, and implementing a website resource like this. So just wanted to make sure everyone was aware of that before we begin. And now I will introduce our speaker for today. So Danita Coulter is an Educational Services Assistant Senior for FindHelpNow.ky.org, which is the only near real-time substance use disorder treatment locator in Kentucky. She completed her undergraduate studies at Eastern Kentucky University, where she holds a Bachelor of Arts in General Studies, and she is currently pursuing a Master's of Science in Social Work. Additionally, she obtained her Associates in Science in Paralegal Studies from Sullivan University. Danita brings over 11 years of experience in community outreach and key stakeholder engagement. And she uses these skills to educate stakeholders about the benefits of the treatment locator tool while also encouraging them to register as substance use disorder treatment providers. Danita uses her quality assurance and technical assistance skills to ensure that the website remains up to date and relevant, and that end users have a quality user experience when searching for near real-time available substance use disorder treatment options. She serves in a leadership role in cultivating and implementing stakeholder engagement by developing and providing quality informational process improvement and educational training for the stakeholders and various partner organizations. So that is Danita in a nutshell, and I will now, I'm going to stop sharing my screen and allow her to share hers so that she can start her presentation.
Thank you, Catherine. See if we can get this right. All righty. Okay, can you see the presentation mode?
Yes, it's on the onboarding slide.
Okay, so as Catherine mentioned, I'm going to talk a little bit about how here in Kentucky, we've developed some of our best strategies, standard operating procedures, sort of daily processes that we've built around our provider management, how we've leveraged and built our key partnerships and some of the methods that we've used as far as marketing the substance use disorder treatment locator website. So how do we get on this slide? This is not the first slide, Catherine. Just a moment. I'm going to stop sharing for a moment.
While Danita is getting the slides in order, if you would like to introduce yourself and let us know where you're from in the chat box. We'd love to see who all is here and where you're coming from.
All right, Catherine, can we see the right screen now?
So yes, we see all the slides.
All right, let's try this again. Okay.
Now
So
we see
now
your notes, which is fine if that's the way it works.
No, we don't want to do that. Let's wait.
There we go. And it's on
All
the
right.
outreach slide again.
Why do we keep going to that slide? I don't understand what's going on. I swear we do better than this, guys. Okay, we're going to talk about outreach onboarding. We were doing some practicing before, so it always works much better before. So bear with us, and I apologize for this. But again, we're going to talk about some of the best practices that we've used here in Kentucky towards outreach onboarding and how we've maintained some of the substance use disorder treatment facilities that have chose to partner with us and onboard to the treatment locator website. So when you first begin the process of onboarding these facilities, you want to talk about your outreach and begin to develop a strategic outreach plan for your jurisdiction. So in doing so, you want to begin to start with identifying your target audience, talk about selecting what is the best method for you towards your recruitment, and then just sort of develop and target how you are going to develop that best explanation of how those substance use facilities that choose to partner with you will best benefit. So what Kentucky has used to sort of guide us, the best thing that you can use to explain this to them is that you just use what you have, which is your grant. So we use our grant and our linkage to care activities to help us develop our audience, and the audience builds those methods. And that statement is built based from those linkage to care activities. So for example, here in Kentucky, one of our main goals is that we want to increase the number of data waiver or MAT providers that register onto the website. So with that in mind, some of the activities that we use to locate that audience of providers is that we have used the SAMHSA website, and there is a list of data waiver providers that are on that website. So from that list, we use that list to compare the providers that are currently registered on FindHelpNow. So those that are actively participating, we have those. And so from that list, those that are not registered already, we know that we now have a group that we have identified as a targeted outreach audience. Again, we use state and local health departments to help develop our outreach audience. Your state and local health departments give you access to different groups of treatment facilities that you may not have access to. For example, there are facilities that you may not have access to due to geographic. You may not be able to travel to those locations. And we'll talk about this in some slides in the future, but right now, virtually, we're able to reach a lot more people that we could not see in person. So our health departments help us reach those facilities and outreach and onboard those. So when you begin when you decide to either adopt a tool in your jurisdiction or adopt a platform that's similar, you're going to want to figure out if you want to onboard licensed facilities or non-licensed. So if you decide that you want to onboard facilities that are licensed, then you're going to want to form relationships with your state licensures board. If you have a contact we use BHSO and AODE license list here in Kentucky. So much like the data waiver licensure list, we do the same process. We're able to pull those lists and compare who do we have that's already registered, who do we not have, and we do the outreach based upon that list. Statewide and regional call centers, those are pivotal for us. What we have done is partnered with the KY State call center. So when individuals are using the platform to seek substance use disorder treatment through our partnership with the statewide call center, they're able to speak to live individuals. Well, how that helps us in outreach is that our statewide call center also has relationships with facilities that we may not be aware of. So they will send us emails and connect us with those facilities or providers, and we're able to onboard them as well. So you're going to want to identify your recruitment methods. When the website was first created, it was created through boots on the ground. This team was created before I came on board, and Catherine was on board before I came. So this was a lot of going door to door, identifying facilities by using those lists that we had mentioned earlier, And they were actually going out to these facilities, introducing themselves and giving the pitch about, this is who we are, and this is what we hope to do in the community. Would you like to partner with us? And they were onboarding facilities right there, taking their laptops out and doing that in person. So with COVID, we've had to sort of pivot and be flexible with our recruitment methods. So the way that we were able to do this successfully is that we created these standard trainings and presentations. So what we've done with those, and they're flexible in that we can do these trainings for small groups, or we can do them for larger groups. We can do these at exhibits and presentations, or we can go into a substance use disorder treatment facility. So we create these presentations that give the audience a hands-on demonstration of what the treatment locator tool does. So with the treatment locator tool, you can locate substance use, near real-time substance use treatment availability in less than 1 minute by completing a general search. You complete that general search through the landing page. So we show our audience how simple that is, give them that hands-on experience by doing that. Then we expand that search by showing them how we have all these different filters where we can be really specific, where people that have specific needs can find a search in less than 3 minutes. So we give people this picture and this hands-on experience of how this website will benefit their treatment facility and encourage them to register. And they can do this right from the website. We have a contact us tab where individuals can just register right there from the website. So we do this again at these exhibits, at presentations. We take these opportunities to serve as keynote speakers so that we can, again, do these presentations to demonstrate the website. We can highlight, based on the audience, the different filters. We have over 60 filters on the website. So we use these opportunities as keynote speakers to highlight what those filters do. We highlight the enhancements of the website. The great thing about the website is that the flexibility that we offer, our website has grown throughout. I've been with FindHelpNow for a little bit over 2 years now. And in the time that I've been here, we've created several enhancements as far as our filters and the audiences that benefit. When I first came on, we did not have the pregnant and postpartum filter. Through our partnership that Catherine led with our Tennessee jurisdiction, we were able to build that pregnancy postpartum filter, which gave us an opportunity to serve as a keynote speaker at an exhibit and event. So those are the different types of things that have been successful for us as far as our outreach and recruitment. We've supplemented those things by identifying audiences through mail campaigns. A great opportunity for us is our partnership with the university and the College of Public Health, where we have had opportunities to be highlighted in newsletters. We partner with the state, so we've had opportunities to be highlighted in newspaper articles. And then through our partnerships with one of our substance use disorder treatment facilities, they actually have a radio podcast. So we had an opportunity to be a speaker on one of their podcasts to highlight the treatment tool. So those are some of the things that you can do as far as recruitment and leverage partnerships through your recruitment. We have social media. We make sure that our social media platforms are active. And while we are active, we want our treatment facilities to follow us. But we also look for people who have the same interests, and we make sure that we follow and participate in those conversations as well. So when you're out and you're doing your outreach, the main thing that you want to stress, which is the theme as far as your outreach, as far as your marketing, is that you want to be consistent, that the goal is common for all of us, whether it's harm reduction, whether it's through our first responders, our public safety professionals, the families of those who are experiencing substance use disorder, or those individuals. The goal is common, and that goal is that we want to decrease the number of drug overdose deaths. So we want to make sure that while we're out marketing, while we're serving as keynote speakers, while we're at these events, that we make sure that we make people aware that, we're here to provide that linkage to care to assist with this ultimate goal. But the additional benefit to any provider that wants to participate or partner with us is that they also get to market their treatment facility, and it's free marketing for them. And then another great aspect of the website is that we offer analytics. So many of our health departments and some of the state entities have expressed to us that they are interested in treatment capacity. So we're able to provide to them treatment slot availability and treatment type availability upon request. So data is important when we're talking about decreasing the amount of drug overdose deaths. So when we talk about it, people want to have that data to back that up. So that is another good marketing tool that you can use when you are selling this idea to your jurisdictions, when you go back and talk to them about trying to adopt the platform. So we'll talk a little bit about how we are able to maintain our provider management, talk about leveraging partnerships more, and about some of the methods that we use when we market. So these are Kentucky specific, and these are things that we do daily as far as engagement. So when everything that happens as far as the website is automated. So that is another thing that makes the website or the treatment locator tool attractive. So when we talk about engagement with the website, and when we try to get our providers to onboard with the website, we want them to understand that when you implement FindHelpNow into your daily practice, that it's not an additional step that's going to take away from their daily duties, that it's something that's going to enhance and provide that quick linkage to care. But in order for that to occur, there's daily processes that we have to do on our end as well as on their end. So from the back end, which is the administrative side, which is what your staff would be responsible for, it is managed through a mailbox system that we have and that we maintain. So for Kentucky, we have these main mailboxes that we look at daily. They are separated into main folders and subfolders. So each day we process the request for publication, our new provider requests, and any technical assistance requests that come through. All of these folders are processed, maintained daily throughout the day. So to further encourage provider participation, this can be done directly from the website. So the website it's very user-friendly on the front end as well as the back end. So the way that you can tell that your providers are participating in the website, you can easily distinguish patterns from your providers by looking at the reports that are available within the website. So each day what we do, we complete what's called, it's a CVS pool, so a daily data extract, so that we can look at all the we can look at all the statuses And notice that any facilities that are in a status of not published means that they have not completed their updates according to the updating schedule. So we can look at that list, which prompts our team to then engage with that facility, either by phone call or email, and encourage them to update their listings. So updating for a facility is just like searching for a treatment. It takes less than 2 minutes for them to update their listing. So we'll reach out by email or by phone call and encourage them to update. But the extra thing that we have from the website is that we can look on our end and we can see how many notifications, automatic notifications have gone out since the last time an update was processed. And that can sort of prompt the type of outreach that our team completes. If we notice that there's been, say, for instance, over 20 notifications, automatic notifications that have sent, then maybe we need to research if there has been turnover in staff or if that facility has closed. So it sort of guides our research. So the website actually helps guide the type of outreach that you do with your providers that you currently have onboarded. So creating partnerships and spreading awareness through these partnerships helps the treatment facilities feel like they are part of something that is larger than themselves and making an impact within their communities. Some of the things that we do, even when we have our providers onboarded, is that we participate in coalitions, we participate in the meetings that the providers have, different trainings that may be offered. We sign up on listservs and things like that. So we stay engaged with the providers once they are onboarded to the treatment locator tool. We identify professional groups. As we participate in something that's called the Treatment Advisory Group. So it's a group of healthcare professionals. There's people that are involved with law enforcement, substance use disorder treatment facilities. So each month we meet, we provide updates. That's another form of outreach. There's always someone that's talking about a new facility that has opened. So there's a way to engage and network and continuously onboard new facilities by participating in these types of meetings and groups. Establishing partnerships with your local government entities, that helps you as you continue to develop your website and continue to enhance and work on the quality assurance of your website, which we'll talk about in the future. Helps you develop those focus groups that you're going to want to help engage with your website. Your partnerships with your local health departments and your gel exchange programs, your syringe exchange programs, those things have been pivotal for us during the pandemic. When we were unable to travel, those mobile groups were able to get out to places that we were not able to reach. They continue to market FindHelpNow, spread the word about the treatment locator tool, and continue to engage people that we were not able to reach, who were unaware of the website. So we continued even during COVID to onboard new facilities. The drug courts, the prisoner reentry programs, those are also entities that we engaged with, established partnerships with. They continue to, these help us to reach the families and individuals who are seeking treatment. We established dynamic relationships with the emergency medical services, and these are our first responders. We were able to collaborate with one of our sheriff's offices to help them establish an outreach team for people who have overdosed. They wanted to establish a quick response team. So we were able to collaborate and facilitate partnership meetings with them so that they could establish a quick response team in their county. These are some of the outcomes of these partnerships. We talk about how being flexible, and I talked about how the different filters that we have help build the audiences, and those audiences help establish partnerships. So this example, I don't know how big that is. This first example over here is one of our partnerships that we established is with, we had a group called the Eyes on Hope Task Force that worked with individuals who are deaf and hard of hearing. So through our partnership with the state and through this group, we created enhancements to the website where individuals who are deaf that are looking for substance use disorder treatment can easily identify substance use disorder treatment facilities that have interpreters available. We created icons on the website. We created this one pager. We created a YouTube video that actually provided instructions on how to use the website. So through leveraging your partnerships, you can create these extra resources, and you can also enhance the tool. So we continue to build the tool based on where we have found the need, and that's the good thing about leveraging partnerships. The second document that you see is through our mayor's office. We established a partnership with them where they basically vet the new substance use disorder treatment facilities that established in Fayette County. So they wanted to know what is the best way to vet these people? Well, we want to talk to these people about FindHelpNow and encourage them to register on the website. So we created these one-page informationals so that when the task force at the mayor's office met with these new substance use disorder treatment facilities, they provided them with this documentation so they could connect them with us so that we could begin the onboarding process. And this last one that you see is a sticker. These stickers were actually the brainchild of one of our local health departments through their syringe exchange program. This is one of our marketing pieces, that one of our most requested marketing pieces. So we were actually at a meeting where they talked, he presented the idea that each month we have over 100 people that come to our syringe exchange programs. We want to try to get treatment for them. A lot of them don't know about FindHelpNow. What do you think about creating a sticker to put on the little syringe exchange? I always draw a blank of the thing, the little syringe exchange thing. So we create these stickers, and we get this request a lot. So each time that an individual comes to the harm reduction programs, they find out about, they get the information about FindHelpNow, and this QR code makes it easy for them to go through the website from their phone. Excuse my voice. Some additional things that we have created. We have these little pocket cards that our judges keep these informations from the drug courts. They have these on their benches that they use. We have established these partnerships with probation and parole programs. And then through EMS, we have a couple of different partnerships that we have established with them. They requested specifically that they wanted these bright colored cards that they would keep on their ambulance, so that when they do respond to the overdose, what they have told us is that many times they go to an overdose scene, individuals are not interested in going to the hospital after they've revived them from Narcan, but they've gone to the same place more than once. So they kind of feel helpless. What can we do? So they can give them this card, at least leave them this card with the information, and they wanted it to be bright so that it stood out. So we created this bright card for them. An additional thing that we did for them is that we partnered with the Kentucky Board of Emergency Medical Services to include FindHelpNow information in their annual training that is required by their first responders. So each time a first responder takes their mandated training, there is a one-pager informational about FindHelpNow that makes sure that all of their first responders are aware of the website or the substance use treatment locator tool. So some of the other strategies that we use that encourage facilities to update is that we have what we call digital tracking links. And so with these links, individuals, wherever individuals have FindHelpNow listed as a hyperlink on their web pages, we can replace those hyperlinks with what's called a digital tracking link. It's common with our health departments. Some of our hospitals use it on their home pages. So those links, what it does is they can do a data request to us, and it can tell them how many times individuals have gone from their website and clicked on to FindHelpNow looking for substance use treatment. So we work with our marketing team to provide them with those digital links. These are just additional strategies that help enhance the marketing of the website. So this list, you can just look through the list, and these are some of the things that I've already mentioned before. You know, we actively participate in the conferences and all these different outreach events. I'm sorry, I'm losing my voice, Catherine, but I'll try to keep pushing on, guys. But one of the main things, and we just talked about this one the other day, is through subscribing to emails and listservs. I'll just give a quick example. Just the other day, we were doing some sort of outreach on another project where we found that FindHelpNow was listed on another website, which provided an opportunity for us to connect with someone else and sort of provide them with these digital links and help them to enhance their website, to provide the tracking links for us and for our state partners as well. So we talked about the facilities engaging and how with them engaging, it helps the users find that near real-time availability. Well, with that, the other end of that is that we must also engage and complete quality assurance. We must make sure that we are actively monitoring our mailboxes and that we're actively participating in the technical assistance that might be requested. So we've created standard operating procedures and best practices. We have those written. Those are available at your request. Catherine has those. But some of the things that we do every day, just standardized practices, is that we log on to the front end of the website so that we can see the end user experience. And so we would log on to the public facing side and we would perform a general search just as an end user would perform. We do the general search, we perform the advanced search, we make sure that all of our filters are working, we make sure that every digital link works. Some of the features on the website are that we have the call to click, so we make sure that any clickable link on the website functionality is working properly. Google Maps, we have that functionality as well, where individuals can go to Google Maps. They can send the directions to the facilities directly to their phones. So we make sure that all of those things are accurate. Check every link on the menu bar as well. and look at we click into the facilities and make sure that every piece of information in the facility is working as well. From the website, on those additional tabs, you can also request your marketing materials, which is a recent enhancement that we have created. So you can request our marketing materials either digitally, or you can request that we mail those to you as well. So those are things that we process daily as well. And we keep what we have implemented in-house is that we just log those daily, and we log those for a couple of reasons, mainly to ensure that we have adequate marketing materials in-house and available. But we also want to make sure that we have an idea of our partners that engage with us. So keeping track of our partnerships for future events and things like that, we want to make sure that we have a good idea of who is actively engaging with us. So we log those partners as well. Our new provider request, we monitor that throughout the day because we don't want to have a new provider request go unanswered. Within those standard operating procedures, we have established timelines. So we always tell them that we have 24 hours to answer those throughout the weekday. And on the weekend, we have 48 hours after 5 o'clock on Fridays. So we monitor the mail, all of our mailboxes daily, respond to them throughout the day. And on the weekend, we make sure that they know that we have 24 to 48 hours to respond to them. When they do the request for publication, even though these are facilities that are currently onboarded, make sure that you just go into each facility, because sometimes personnel change and people will go in and make changes to some of the provider profiles. And so you want to make sure that the provider profile still has accurate information and maybe something has not been accidentally removed. So each time someone requests, just go into it and just look at it thoroughly to make sure that everything is accurate. So ultimately, outreach and onboarding, it requires teamwork. And just the message is that your team, it really expands beyond the individuals who are on your team. So it's going to be those, those first responders. It's going to be your health departments. It's going to be your state entities, all of those people that invite you to be keynote speakers, ask you to come to their events. Because when you're not available to do your outreach, they're going to do that outreach for you. We constantly have people that come to us and say, I tell everybody, I always tell people wherever I am about FindHelpNow. So you want to establish those types of relationships with people. So whenever we're not able to attend events, we always make sure that we send marketing materials. So never miss out on an opportunity to send marketing materials. But then consider the strength of your team members so that you can strategically place them in the places where they'll be most effective as far as your outreach. Some people are best talking about data. Other people are better with bringing in those key partners. So just make sure that you know where your team members are best suited. And just remember that outreach and maintenance are ongoing. So stay involved with the people who have onboarded. Make sure that they are updating and publishing, and then make sure that your team is always daily doing your quality assurance and looking at the back end of the website to make sure that everything is in order. So this is our contact information. If you have any questions, we can answer those now. And also, please make sure that you take a few moments to complete the survey.
Thanks, Danita, for your presentation and for pushing through. These Kentucky allergies are no joke, and it's all the trees are starting to bloom right about now. So, but yeah, like Danita said, does anyone have any questions for Danita? Questions or comments? I'm gonna put our email addresses in the chat box as well, in case you don't have any now, but maybe you think of something later. Feel free to email us. And if there aren't any questions, I'll give you 15 minutes of your day. Thank you all again for joining us. I will send out a follow-up email that has kind of a summary. It'll include Danita's presentation slides. It'll include a link to the survey as well as a recording of the webinar. And if that's all there is, y'all are free to go. Thank you again for joining us today.
Catherine, I did have a quick question, if I could pop that in. Sorry, my camera. So I am actually meeting with some stakeholders next week to see if they're interested in signing on for FindHelpNow. And something that I think might get brought up with just the way our community is trending right now is, does Kentucky currently, or is it an option to list harm reduction resources as like an option instead of like, where MAT and everything's listed, like harm reduction an option that we can put up there?
So as it sits right now, we can't add those. You would have to add those like on the resources page or on the frequently asked questions page. Those would be where you would be able to, but as far as like, I don't know, meetings or something like that, that would have to go. Yeah, we don't
remember we had them as a link. On FindHelpNow, when you on the search results page, we did have them, but that page is now being rebuilt. So I think we removed them. But Catherine can work with you more on that. But there's like this gray space that we had on FindHelpNow. So we wanted to fill that gray space. So we've put a link there for our harm reduction programs. So there would be a place that you could like add a link for them there.
Okay.
Yeah, and then also, yeah, where you're customizing your landing page and you're entering all that big open text space, that's another place that you can add a link to a website. And then you also have those banner options. So like, how we have that green COVID banner at the top. Tennessee has their Tennessee Red Line banner at the top. So that's another option. If there are like a harm reduction website or something that the state has or that your community has that kind of houses that sort of information, you can just make that your banner. Or like Danita said, on your search results page, you can add those links, or on the home page in just the general description. But as far as adding them as if they're kind of a treatment option, or, in addition to that, we don't have that right now.
Okay, cool. So, thank you. Sounds like there's options.
And I did get your email, and I apologize for not responding.
That's okay.
I'm creating a list of things that you can use moving forward. So I will have that to you today.
Cool. Thank you. I will let you know how the meeting goes with them.
Okay. Yeah, please do. Please do.
Awesome. Cool. Thanks for your help.
Yeah,
thank you for the presentation.
Molly. Thank you.
Talk to you later.
I'm sorry that my voice was going away.